before I get into the muscles and functional elbow movements, I want to make one other note about the arthrokinematics at the radial ulnar joint. The closed packed position of the radial ulnar joint is either full pronation or full supination, so both of those motions will put the radial ulnar joint in a closed packed position. The open packed position of the radial ulnar joint is 70 degrees of elbow flexion with 35 degrees of supination. So that will put the radial ulnar joint in an open packed position. What I'm going to have you do, it's sort of an informal assignment. It's nothing that I want you to hand in, but I want you to think about if you had to mobilize into pronation or supination at both the proximal and distal radial ulnar joints, what type of mobilization would you do? So knowing your convex-concave rules and knowing how the moving surface at each one of those joints is different, how you would go and do that. So I want you to think about that. We can discuss. We'll discuss it in class. If you have questions in the meantime, or you think you figured it out, you could come and see me or ask that question at your convenience. As far as the functional movements at the elbow, so with simple movements, we know with flexion and extension at the elbow, we have our agonist and antagonist. So your flexion, you have your elbow flexors, your brachialis, your brachioradialis, and your biceps brachii being recruited at different points depending upon position of the forearm and the weight of the load. Your antagonist would be your triceps, and with extension, obviously, it would be reversed. Your triceps would be your agonist, and your elbow flexors would be your antagonist. When you get into more complicated motions, you do get a lot of muscle synergy occurring at the elbow joint. So, when you do simple movements, be it flexion or extension, you're going to be, again, recruiting the muscle groups responsible for that movement. If, however, you go to do something slightly more complex, and I have the example up here, if you go to open up a tight jar, you'll notice that you'll recruit both the biceps and the triceps synergistically to act as a stabilizer at the elbow. So it's not uncommon with more complicated movements to recruit both of those muscles in an effort to help stabilize the elbow joint. Anytime you're looking at how the muscles get recruited, your single joint muscles will always get recruited first. So for instance, with simple elbow flexion activities, the brachialis, because it is a true single joint muscle, will get recruited first. The biceps brachii, which actually crosses three joints. It crosses the glenohumeral joint, it crosses the elbow joint, and it also crosses the radial ulnar joint, will be recruited later. And we'll talk about how active insufficiency can affect the biceps brachii depending upon the position that you're in. So your single joint muscles will always be your initial recruitment for all of your activities. Examining some other aspects of muscle function at the elbow, in looking at elbow flexion, depending upon where you're at in the range of motion and the positioning of the forearm will dictate the function of the elbow flexors. The elbow tends to be the strongest in flexion in the range of 90 to 120 degrees within the range of motion. That's where you get the most leverage from your moment arm and the biceps attachment. The biceps brachii provides a great deal of strength, particularly when the forearm is supinated because of the positioning of the biceps with that motion. The brachialis pretty much contributes regardless of the positioning of the forearm. Obviously, when the forearm is pronated, the brachialis takes on a much larger portion of the movement because of the fact of the biceps brachii being taken out when the forearm's pronated. The brachioradialis is primarily only going to function at a great deal of strength with elbow flexion when the forearm is in a neutral position. Looking at supination and pronation, with the elbow flexed at 90 degrees, the biceps brachii has a much greater influence on the supination strength than when the arm is extended. The further the arm gets into extension, The supinator muscle provides more of the strength into supination as the elbow is getting extended. The closer, again, it gets to 90 degrees, the biceps brachii will contribute to a much greater extent. Looking at pronation, you have two muscles that produce pronation at the forearm. You have the pronator teres and the pronator quadratus. The pronator teres is the stronger of the two pronators. It is superficial, and you can actually palpate on the in the region of the anterior surface of the elbow, the pronator teres. It functions greatly with the elbow in flexion as well, because actually the pronator teres is also a weak elbow flexor because it does cross the elbow joint. As the elbow is extended and you start to have slower pronation, less force, the pronator quadratus will contribute a little bit more to the motion at that point. Looking at elbow extension, you have the triceps and the anconeus being the single joint muscle. The triceps is a multi-joint muscle because it also crosses the shoulder joint. The greater the demand increases the recruitment of the tricep with low force. It's believed that the anconeus has enough sufficient strength to maintain low force levels, although the greater the force gets applied, the more the tricep will kick in. In looking at the action of the multi-joint muscles, so if we break down how the biceps brachii works, so to produce active insufficiency of the biceps brachii, what you would do is you would flex the shoulder, flex the elbow, and also have the arm supinated. That would produce an active insufficiency at the biceps brachii, which actually crosses three joints. It crosses the glenohumeral joint, it crosses the elbow joint, and it also crosses the radioulnar joint. If the biceps were to contract without being opposed at all, it would actually produce all of those motions. Now, it is not a strong flexor of the shoulder, but it can produce and contribute to shoulder flexion. With the triceps is a multi-joint muscle. It also crosses the glenohumeral joint and the elbow joint. You can make it actively insufficient by extending both of those, and it does act as a weak shoulder extensor, albeit it is not a prime mover for that motion. Now, a great deal of things we do with the elbow and forearm function in an open kinetic chain. However, there are some activities that are done in the closed kinematic chain. And the way this basically works, and we're going to talk about here, is discuss the stability of the elbow during closed chain motion, since essentially it's going to be bearing weight. In full extension, a great deal of your stability is going to be provided by the bony stability, the bony configuration, and the ligaments in the area. Once you begin to initiate flexion, and you can actually see this for yourself if you go and do, say, a push-up. When you initiate flexion, you'll notice that there will be a certain degree of co-contraction going on with the biceps and the triceps, because of the fact what that's doing is stabilizing the elbow. Now, that doesn't change what the prime mover is going to be with the motion. For instance, when you do a push-up and just looking at the elbow, as you go to lower him to a push-up, you're eccentrically contracting your triceps. You still have that being your prime mover and your agonist, but to stabilize the elbow, you will get some slight co-contraction. So that stability at the beginning of motion is going to be provided by muscular co-contraction, whereas in full extension, your stability is provided by the bony configuration and the ligamentous arrangement. Here I want you to kind of examine this picture. So for discussion purposes, I want you to look at this now, and this will be something we kind of talk about if we have time in class, and we'll bring it up. I want you to look at this picture. What pathology would be going on here? And I also, as you're kind of examining this, I want you to think about ways that we can possibly prevent this, in addition to treating it if necessary, if an injury happened to occur. So think, what's the injury? What structures are involved? What could be done to prevent it? what could be done in the instance that an injury has already taken place, and what could be done to treat it. And then just another activity thing, just to kind of keep this a little interactive and get you to think a little bit. So, movement analysis. So, looking at placing your hand behind your head. If you were to place your hand behind your head, say for instance that was to comb the back of your hair, what I want you to do is think of the motions that are going to be occurring from everything from the shoulder down to the elbow, and also what type of muscular action, if you were to have a comb and be going along the back of your head, what would have to be happening in order to have that occur from a muscular action standpoint. So I want you to think about that. And the second thing is with pulling activity. So pulling exercises or resistance exercises involving pulling in both the open and closed kinetic chain. So with the closed kinetic chain, think of the chin up, okay, where the biceps or the palms are facing the person. What is going to be the primary motion or muscles involved with that in both the lifting and the lowering phase? And in the open kinetic chain with the hands pronated, what would be some of the differences when you're looking at what would be going on with those two different motions? And these would be your learning outcomes. So I want you to, again, those things that I talked about, again, I wanted to try to keep this a little interactive and kind of have you think a little bit. Nothing is formally an assignment per se, but I kind of want, if we get time, which I think we'll discuss some of those ideas in class. Regardless, I think it's something that even if you don't understand or don't see why something's happening, I'm going to encourage you to come and see me or bring up the question in class so that we could at least discuss something to maybe clear up some misunderstandings. So make sure you do that, and that's all for this presentation.